Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. A randomized trial of intravenous amino acids for kidney protection. Background. Acute kidney injury, AKI, is a serious and common complication of cardiac surgery, for which reduced kidney perfusion is a key contributing factor. Intravenous amino acids increase kidney perfusion and recruit renal functional reserve. However, the efficacy of amino acids in reducing the occurrence of AKI after cardiac surgery is uncertain. Methods. In a multinational double-blind trial, we randomly assigned adult patients who were scheduled to undergo cardiac surgery with cardiopulmonary bypass an intravenous infusion of either a balanced mixture of amino acids at a dose of 2 grams per kilogram of ideal body weight per day, or placebo, Ringer's solution, for up to 3 days. The primary outcome was the occurrence of AKI, defined according to the kidney disease, improving global outcomes creatinine criteria. Secondary outcomes included the severity of AKI, the use and duration of kidney replacement therapy, and all-cause 30-day mortality. Results. We recruited 3,511 patients at 22 centers in 3 countries, and assigned 1,759 patients to the amino acid group and 1,752 to the placebo group. CACI occurred in 474 patients, 26.9%, in the amino acid group, and in 555, 31.7%. In the placebo group, relative risk, 0.85. 95% confidence interval, CI, 0.77 to 0.94. P equals 0.002. Stage 3 AKI occurred in 29 patients, 1.6%, and 52 patients, 3.0% respectively. Relative risk, 0.56, 95% CI, 0.35 to 0.87. Kidney replacement therapy was used in 24 patients, 1.4%, in the amino acid group, and in 33 patients, 1.9%, in the placebo group. There were no substantial differences between the 2 groups in other secondary outcomes or in adverse events. Conclusions. Among adult patients undergoing cardiac surgery, infusion of amino acids reduced the occurrence of AKI. Azithromycin to reduce mortality, an adaptive cluster-randomized trial. Background. Twice-yearly mass distribution of azithromycin to children is a promising intervention to reduce childhood mortality in sub-Saharan Africa. The World Health Organization recommended restricting distribution to infants 1 to 11 months of age to mitigate antimicrobial resistance, although this more limited treatment had not yet been tested. Methods. We randomly assigned rural communities in Niger to 4 twice-yearly distributions of azithromycin for children 1 to 59 months of age. Child azithromycin group, 4 twice-yearly distributions of azithromycin for infants 1 to 11 months of age, and placebo for children 12 to 59 months of age. Infant azithromycin group, or placebo for children 1 to 59 months of age. Census workers who were not aware of the group assignments monitored mortality twice yearly over the course of 2 years. We assessed 3 primary community-level mortality outcomes: deaths per 1,000 person-years, each examining a different age group and pairwise group comparison. Results. A total of 1,273 communities were randomly assigned to the child azithromycin group. 1,229 were included in the analysis. 773 to the infant azithromycin group, 751 included in the analysis, and 954 to the placebo group, 929 included in the analysis. Among 382,586 children, 419,440 person-years, and 5,503 deaths were recorded. Lower mortality among children 1 to 59 months of age was observed in the child Azithromycin group, 11.9 deaths per 1,000 person-years, 95% confidence interval, CI, 11.3 to 12.6, then in the placebo group, 13.9 deaths per 1,000 person-years, 95% CI, 13.0 to 14.8, representing 14% lower mortality, with azithromycin, 95% CI, 7 to 22, p less than 0.001. Mortality among infants 1 to 11 months of age was not significantly lower in the infant azithromycin group, 22.3 deaths per 1,000 person-years, 95% CI, 20.0 to 24.7, than in the placebo group, 23.9 deaths per 1,000 person-years, 95% CI, 21.6 to 26.2, representing 6% lower mortality, with azithromycin, 95% CI, -8 to 19. 5 serious adverse events were reported, 3 in the placebo group, 1 in the infant azithromycin group, and 1 in the child azithromycin group. Conclusions. Azithromycin distributions to children 1 to 59 months of age significantly reduced mortality and was more effective than treatment of infants 1 to 11 months of age. Antimicrobial resistance must be monitored. Next, we will be discussing articles from Journal of American Medical Association. Elinzanetant for the treatment of vasomotor symptoms associated with menopause. OASIS 1 and 2 randomized clinical trials. Question: what are the efficacy and safety of Elinzanetant 120 mg in postmenopausal individuals with moderate to severe vasomotor symptoms, VMS? Findings: in 2 pivotal phase 3 clinical trials, Elinzanetant demonstrated statistically significant reductions in VMS frequency and severity versus placebo. Elinzanetant also significantly improved sleep disturbances and menopause-related quality of life versus placebo. The safety profile was favorable, meaning Elinzanetant is an efficacious and well-tolerated selective neurokinin 1,3 receptor antagonist for the treatment of moderate to severe VMS associated with menopause. Elinzanetant also improves sleep disturbances and menopause-related quality of life. Characterizing long COVID in children and adolescents. Question: what prolonged symptoms experienced by youth are most associated with SARS-CoV-2 infection? Findings among 5,367 participants in the Recover Pediatrics cohort study, 14 symptoms in both school-aged children, 6 to 11 years, and adolescents, 12 to 17 years, were more common in those with versus without SARS-CoV-2 infection history, with 4 additional symptoms in school-aged children only, and 3 in adolescents only. Empirically derived indices for PASC research and associated clustering patterns were developed, meaning this study developed research indices for characterizing pediatric PASC. Symptom patterns were similar but distinguishable between school-aged children and adolescents, highlighting the importance of characterizing PASC separately in different age groups. Next, we will be discussing articles from Annals of Internal Medicine. Effect of starting dialysis versus continuing medical management on survival and home time in older adults with kidney failure, a target trial emulation study. Background: for older adults with kidney failure who are not referred for transplant, medical management is an alternative to dialysis. Objective: to compare survival and home time between older adults who started dialysis at an estimated glomerular filtration rate for less than 12 milliliters per minute (1.73 square meters) and those who continued medical management. Results: among 2,440 adults, mean age 77.9 years, SD 8.8, the median time to dialysis start was 8.0 days in the group starting dialysis and 3.0 years in the group continuing medical management. Over a 3-year horizon, the group starting dialysis survived 770 days, and the group continuing medical management survived 761 days. Difference: 9.3 days. 95% CI, minus 17.4 to 30.1 days. Compared with the group continuing medical management, the group starting dialysis had 13.6 fewer days at home, CI, 7.7 to 20.5 fewer days at home. Compared with the group continuing medical management and foregoing dialysis completely, the group starting dialysis had longer survival by 77.6 days, CI, 62.8 to 91.1 days, and 14.7 fewer days at home, CI, 11.2 to 16.5 fewer days at home. Conclusion. Older adults starting dialysis when their EGFR fell below 12 milliliters per minute / 1.73 square meters, who were not referred for transplant, had modest gains in life expectancy and less time at home. Next, we will be discussing articles from British Medical Journal. Suicide rates among physicians compared with the general population in studies from 20 countries. Gender stratified systematic review and meta-analysis. Abstract. Objectives. To estimate age-standardized suicide rate ratios in male and female physicians, compared with the general population, and to examine heterogeneity across study results. Results among 39 included studies, 38 studies for male physicians, and 26 for female physicians, were eligible for analyses, with a total of 3,303 suicides in male physicians, and 587 in female physicians. Observation periods 1935 to 2020, and 1960 to 2020, respectively. Across all studies, the suicide rate ratio for male physicians was 1.05, 95% confidence interval, 0.90 to 1.22. For female physicians, the rate ratio was significantly higher at 1.76, 1.40 to 2.21. Heterogeneity was high for both analyses. Meta-regression revealed a significant effect of the midpoint of study observation period, indicating decreasing effect sizes over time. The suicide rate ratio for male physicians compared with other professions was 1.81, 1.5 to 2.12. Conclusion: standardized suicide rate ratios for male and female physicians decreased over time. However, the rates remained increased for female physicians. The findings of this meta-analysis are limited by a scarcity of studies from regions outside of Europe, the United States, and Australasia. Next, we will be discussing articles from Lancet. Activity limitations, use of assistive devices, and mortality and clinical events in 25 high-income, middle-income, and low-income countries. An analysis of the PURE study. Background. The focus of most epidemiological studies has been mortality or clinical events, with less information on activity limitations related to basic daily functions and their consequences. Standardized data from multiple countries at different economic levels in different regions of the world on activity limitations and their associations with clinical outcomes are sparse. We aimed to quantify the prevalence of activity limitations and use of assistive devices, and the association of limitations with adverse outcomes in 25 countries, grouped by different economic levels. Interpretation. The global prevalence of activity limitations is substantially higher in women than men, and in low-income countries and middle-income countries, compared with high-income countries, coupled with a much lower use of gait, visual, and hearing aids. Strategies are needed to prevent and mitigate activity limitations globally, with particular emphasis on low-income countries and women. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles. From Journal of Hepatology Treatment Response and Clinical Event-Free Survival in Autoimmune Hepatitis, a Canadian multi-center cohort study. Baseline markers of disease severity and initial prednisone dose do not predict ALT reduction over 18 months in A. Persistent elevations in AST, but not AG, are associated with decreased clinical event-free survival in A. Higher ALT at 6 months was associated with worse clinical event-free survival in A. Older age and female sex predict ALT response at 6 and 12 months in A. Next, evaluation of a delayed liver transplantation strategy for patients with HCC receiving bridging therapy, the Delta-HCC study. Patients with single curatively treated HCC account for 20% of LT candidates. In these patients, LT can be safely delayed without hampering pre/post-LT outcomes. This strategy has the potential to redirect spared organs to patients in urgent need. The Delta-HCC study supports extension of a delayed strategy to other LT programs. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Thoraco-abdominal wall motion guided biofeedback treatment of abdominal distension, a randomized placebo-controlled trial. Background and aims. Abdominal distension results from abdominophrenic dyssynergia, EA, diaphragmatic contraction, and abdominal wall relaxation in patients with disorders of gut-brain interaction. This study aimed to validate a simple biofeedback procedure guided by abdominothoracic wall motion for treating abdominal distension. Results. Patients in the biofeedback group, N equals 19, learned to correct abdominophrenic dyssynergia triggered by the offending meal. Intercostal activity decreased by a mean ± SE of 82%, ±10%. Anterior wall activity increased by a mean ± SE of 97%, ±6%. And increase in girth was a mean ± SE of 108%, ±4% smaller. And experienced improved clinical symptoms, abdominal distension scores, decreased by a mean ± SE of 66%, ±5%. These effects were not observed in the placebo group, all, p less than 0.002. Conclusions. Abdominothoracic wall movements serve as an effective biofeedback signal for correcting abdominophrenic dyssynergia and abdominal distension in patients with disorders of gut-brain interaction. Here are the articles from Clinical Gastroenterology. An accurate and automated method for adenoma detection rate and report card generation utilizing common electronic health records. Goals. To develop an automated method for adenoma detection rate, ADR, calculation and report card generation using common electronic health records, EHRs. Background. ADR is the most widely accepted colonoscopy quality indicator and is inversely associated with interval colorectal cancer incidence and mortality. However, ADR is difficult to efficiently measure and disseminate due to need for data integration from distinct electronic databases. Results. Validation of the natural language processing algorithm for ADR showed a sensitivity, specificity, and accuracy of 100%. ADR was automatically calculated for 12 endoscopists over a calendar year. 2,276 screening colonoscopies were performed with 775 procedures, having at least one adenoma detected, for a total ADR of 34%. Report cards were successfully generated within the EPIC EHR and distributed to endoscopists by secure email. Conclusion. We describe an accurate, automated, and scalable process for ADR calculation and reporting utilizing commonly adopted EHRs and data integration methods. Next, we will be discussing articles in the field of cardiology. Here are the articles from journals of the American College of Cardiology. Clinical significance of diffusion-weighted brain MRI lesions after TAVR. Background. Acute brain infarction detected by diffusion-weighted magnetic resonance imaging, DW-MRI, is common after transcatheter aortic valve replacement, TAVR, but its clinical relevance is uncertain. Objectives. The authors investigated the relationship between DW-MRI total lesion number, TLN, individual lesion volume, ILV, and total lesion volume, TLV, and clinical stroke outcomes after TAVR. Conclusions. Our study confirms that the number, size, and total volume of acute brain infarction defined by DW-MRI are each associated with clinical ischemic strokes, disabling strokes, and worse stroke recovery in patients undergoing TAVR, and may have value as surrogate outcomes in stroke prevention trials. From JAMA Cardiology. Postpartum ambulatory blood pressure patterns following new onset hypertensive disorders of pregnancy. Question: how frequent is persistent and severe hypertension after hospital discharge following new onset of a hypertensive disorder of pregnancy? Findings: in this cohort study of 2,705 postpartum individuals, a hypertensive disorder of pregnancy enrolled in a remote blood pressure monitoring program, 81.8% had ongoing hypertension after hospital discharge. Compared with individuals with blood pressure normalization, these individuals had increased odds of postpartum emergency department visits and hospital readmissions, meaning these data support the critical role of blood pressure monitoring programs in postpartum individuals with hypertensive disorders of pregnancy. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Differential diagnosis of post-pancreatitis diabetes mellitus based on pancreatic and gut hormone characteristics. Distinguishing different types of diabetes is important in directing optimized treatment strategies and correlated epidemiological studies. Objective: through detailed analysis of hormone responses to mixed meal tolerance test, the MMTT, we aim to find representing characteristics of post-acute pancreatitis diabetes mellitus, PPDMA, and post-chronic pancreatitis diabetes mellitus, PPDMC, methods. Participants with PPDMA, PPDMC, type 1 diabetes, type 2 diabetes, and normal controls, NCs, underwent MMTT, fasting and postprandial responses of serum glucose, C-peptide, insulin, glucagon, pancreatic polypeptide, PP, ghrelin, gastric inhibitory peptide, GIP, glucagon, like peptide 1, GLP-1, and peptide Y, PYY, were detected and compared among different groups. Conclusion: along with the continuum from acute to chronic pancreatitis, the pathological mechanism of PPDM changes from insulin resistance to insulin deficiency. Insufficient PAI secretion is a promising diagnostic marker for distinguishing PPDM from type 1 and type 2 diabetes. Absent ghrelin secretion to MMTT may help identify PPDMC. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Prediction of future Parkinson disease using plasma proteins combined with clinical demographic measures. Background and objectives. Identification of individuals at high risk of developing Parkinson disease, PD, several years before diagnosis is crucial for developing treatments to prevent or delay neurodegeneration. This study aimed to develop predictive models for PD risk that combine plasma proteins and easily accessible clinical demographic variables. Discussion. Our findings support the potential utility of a machine learning-based model integrating clinical demographic variables with plasma proteins to identify individuals at high risk for PD within the general population. Although these predictors have been validated by PPMI, additional validation in a more diverse population reflective of the general community is essential. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Changes in spirometry interpretative strategies. Background. Recent guidelines for spirometry interpretation recommend both race-neutral reference equations and use of Z-score thresholds to define severity of airflow obstruction. Research question: how does the transition from race-specific to race-neutral equations impact severity classifications for patients with COPD when using percent predicted versus Z-score thresholds? And do changes in severity correspond to clinical risk? Results. This cohort included 13,324 patients, of whom 9,232 patients, 69.3%, were white, mean age, 65.7 years, and 4,092 patients, 30.7%, were Black, mean age, 61.1 years. More Black than white patients showed a change in severity classification between approaches when using percent predicted thresholds, 20.2% versus 6.1%, p less than 0.001, but not with z-score thresholds, 12.6% versus 12.3%, p equals 0.68. An increased severity classification with a race-neutral approach was associated with increased risk of exacerbation when using z-score thresholds, or 2.34, 95% CI, 1.51 to 3.63, but not when using percent predicted thresholds, or 1.08, 95% CI, 0.61 to 1.93. A decreased severity classification with a race-neutral approach was associated with lower risk of exacerbation with both percent predicted, or 0.49, 95% CI, 0.28 to 0.87 and z-score, or 0.67, 95% CI, 0.50 to 0.90, thresholds. Interpretation. The proportions of Black and white individuals reclassified were similar with z-score thresholds, and changes in severity corresponded to clinical risk with z-scores. These results support recent recommendations for use of race-neutral equations and z-score thresholds for spirometry interpretation. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Digital spatial profiling identifies distinct molecular signatures of vascular lesions in pulmonary arterial hypertension. Rationale: idiopathic pulmonary arterial hypertension, IPAH, is characterized by extensive pulmonary vascular remodeling caused by plexiform and obliterative lesions, media hypertrophy, inflammatory cell infiltration, and alterations of the adventitia. Objective: we sought to test the hypothesis that microscopic EPA vascular lesions express unique molecular profiles, which collectively are different from control pulmonary arteries. Methods: we used digital spatial transcriptomics to profile the genome-wide differential transcriptomic signature of key pathological lesions, plexiform, obliterative, intima plus media hypertrophy, and adventitia, in EPA lungs, N equals 11, and compared these data with the intima plus media hypertrophy and adventitia of control pulmonary artery, N equals 5. Conclusions: IPA lesions express unique molecular transcript profiles, enriched for pathways involving pathogenetic pathways, including genetic disease drivers, innate and acquired immunity, hypoxia sensing, and angiogenesis signaling. These data provide a rich molecular structural framework in EPA vascular lesions that inform novel biomarkers and therapeutic targets in this highly morbid disease. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Lower dosage, acute peritoneal dialysis versus acute intermittent hemodialysis in acute kidney injury, a randomized controlled trial. The efficacy of acute peritoneal dialysis is still controversial. There was no significant difference in 28-day mortality between acute peritoneal dialysis and intermittent hemodialysis. C3 glomerulopathy recurs early after kidney transplantation in serial biopsies performed within the first 2 years after transplantation. C3 glomerulopathy recurs very early and frequently after kidney transplant, protocol biopsies, and the use of electron microscopy alongside immunofluorescence are key to diagnose recurrent C3 glomerulopathy in the allograft. Here are the articles from Kidney International Reports. Dialysis: outcomes across countries and regions, a global perspective from the International Society of Nephrology Global Kidney Health Atlas Study. Introduction: kidney failure treated with hemodialysis, HD, or peritoneal dialysis, PD, is a major global health problem that is associated with increased risks of death and hospitalization. This study aimed to compare the incidence and causes of death and hospitalization during the first year of HD, or PD, among countries. Methods: The third iteration of the International Society of Nephrology Global Kidney Health Atlas, ISN-GKHA, was conducted between June and September 2022. For this analysis, data were obtained from the cross-sectional survey of key stakeholders from ISN-affiliated countries. Conclusion: there is significant heterogeneity in the incidence and causes of death and hospitalization in patients with kidney failure treated with dialysis. These findings highlight opportunities to improve care, especially in LICs where infectious and social factors are strong contributors to adverse outcomes.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.